And good afternoon, May 14, 2024. I'm Dr. Deuk at Deuk Spine. It's our last surgery for the day. This gentleman comes to us from New York City. And yeah, it's comes at the end of a long day of surgery. You're doing great. Little poke and stick and burn. That's just some numbing medicine going in. You're doing awesome. Thank you for laying still. So he's had back pain for
2 years.
No way. 2 years. It's literally the run of 2 years of back pain today. We've had, I don't know if you guys are just saying that, we've had literally 3 patients with 2 years of back pain. This is our 3rd one. Yeah, it's amazing. Shot. And basically, the pain is coming from the 5-1 primarily. First thing I need to do is get down to the 5-1 disc where the tear is. To do that, I'm using an x-ray machine called a fluoroscope, and I'm using a needle. And we're going to put some numbing medicine. Now, he's here because he did not want to have open back surgery. He didn't want a laminectomy or fusion or microdiscectomy. Those surgeries don't work anyway to cure back pain. He'd been watching our surgeries for a while, and he wanted the Deuk laser disc repair. So let's see if we can't do this for him. Okay, any questions? Feel free to type your questions up. In the meantime, we're going to get started. Our first order of business is get into the disc, and that's not easy. 5-1 is the hardest one to get to. So I'm going to do my very best to get in. Shot. All right. Henry, let's show the audience, why do herniated discs cause so much back pain? What is it about them that causes pain? Shot. All right, you can see from our video how a disc problem will cause pain in the back. It's all due to inflammation. All right. Is that a T2? Yeah. CSF is white? Good. All right. We are, I want to say inching our way, but it's more like a millimetering our way. AP? I just saw him. He's ready to go. Okay. Yeah, the last case is ready to go. Okay. Yeah, the guy we just finished, the bilateral 4-5, he's already ready to go. He's from Atlanta. He's doing awesome. Yeah, he's leaving.
I'm getting great reports from my phone.
Yeah. All right.
Good. You're an output. Good.
Yeah, he's ready to go. All right, we're just about ready here for our discogram shot.
Low pain score.
This guy ready? Because we're ready.
How you doing, my friend? You all right? How you doing? You okay? Okay, we're going to ask you some questions, all right? You're doing great.
Are you having any pain?
You're having any pain in your back?
Remember, he's had lower back pain times 2 years. I don't know if I believe it, but That's my staff is playing a joke on me today. We've had literally 3 patients today with 2 years of pain. And one of them was maybe like 3 years, right? 2, 2, 2, 3. Are you comfy? So this surgery is not only endoscopic and laser, but it's pretty much bloodless. We're going to have literally 2 drops of blood. How bad is that on a scale of 1 to 10? How bad is it?
Give us a number. He said 8.
Is that where you get your pain? Put him to sleep. Yes? All right. So that's where he gets his pain. 8 over 10 concordant. So he's actually, if you were here for the last surgery, you saw us, we put the needle in and the guy jumped off the table. This guy is the opposite, right? So everybody's pain tolerance is different. Some people have a high, some people have a low pain tolerance. But in the end, chronic back pain is very painful for everybody. And, you know, with him, acute pain, sticking the needle, he really didn't care. But chronic pain obviously bothers him. And this was an 8 out of 10. You guys, 8 out of 10 concordant, meaning that's where he gets his pain. Jordan, show us the lateral view there on the x-ray, Henry, where the tear is. Okay? You guys watched the video. See that tear right there, the arrow?
Yes, we
Henry,
do.
they saw the video, right, where the disc causes pain?
Yes,
Shot?
yes. We've shown that.
Uh-huh. So they understand that it's the annular tear in the back of the disc that's the source of back pain. That's
Correct.
all we're fixing, folks. We're literally going to fix an area that's 6 millimeters by like 6 millimeters, or maybe a centimeter long. Okay, 6 by 6 by a centimeter, or 10. And that's what we're doing. And that gets rid of the back pain from the disc that we're treating. Now, if a patient has back pain in other areas, we're not treating that, we're not going to get rid of it. So the key is to diagnose all the back pain sources right away, early on, and treat all those pain sources. In his case, we're treating one disc. Wait, I don't know if, I think he has some other pain sources, right? We're only treating one though. Huh? Oh, we're doing his neck as well? Yeah. Actually, we're doing his neck. He had a fall at work. All right. Shot. So this patient from New York fell at work, and we're fixing his back and his neck. He did not want fusion or shots. He wanted to get fixed. Any questions?
At this moment, no current questions.
Shot? All right. He's doing really good. We're going through the tear. And one more, and we'll go ahead. It's going to be stuck. I can see it advancing together. Luis has got the arms of steel. You know, I did something yesterday I haven't done in a long time. I went to the gym. Yeah. Shot. My surgeon cleared me, shot, to go to the gym. And said you can work out moderately. So I had a lightweight workout, 20 pounds. But I thought I'd be sore today, but I'm not that sore. I guess I didn't work out that hard. Yeah. But it was nice to be in the gym, and I went with my son and my wife.
No.
It's just tissue. Yeah, it's probably just tissue. But I've lost now. I'm below 220. I was up at 290. So I've lost 70 pounds. Yeah.
God, I'm jealous. I'm down 23.
And I feel great. My wife says it's all due to gardening. But I don't eat as much as I used to either. All right, any questions from our audience?
At this
Laser?
moment, no current questions.
So we know this disc is causing his back pain because we tested it. And he had 8 out of 10 pain. That means on a scale of 1 to 10, 10 being the worst pain of your life, he had an 8. And it's quite possible that that 8 was actually, it was worse than an 8, but he was still feeling a little good from the medicine we used to put him to sleep. right, B? So realistically, I think this is all scar tissue here, by the way. This is not normal. See the white stuff? That's not annulus, that's not normal disc, that's scar tissue. It's very thick. I can feel it with the laser. It's hard. It's got calcium on it. See, you guys see the yellow and orangish color? That's calcium. That shouldn't be there. That's only there when you have a lot of inflammation. It happens with years of inflammation. Years. So this is, I don't know how old his injury is, but he's had this disc injury for years. The thing about work comp, we do a lot of work comp, and I understand work comp quite well. And the thing that the adjusters like to always try to get out of paying for the patient's treatment is they say that the disc injury is old, you know. Now you can have an old disc injury that's asymptomatic, no symptoms, and patient has no pain, they don't need treatment. And then you re-injure it at work, and then it hurts, and they need treatment. And if that's the case, then, well, then the work comp has to pay for that treatment because it's directly causally related. Even though the disc injury predates the work comp accident, the original disc injury, the onset of symptoms and the new disc injury correlates with the accident. And that's the thing that a lot of people either don't understand or don't want to understand. Of course, the insurance companies are always trying to get out of paying, so the way they say it is they say, oh, it's an old disc injury. Look, the MRI shows an old injury. But the reality is, yes, the patient may have had an old injury, but it wasn't causing any problems. So they didn't need treatment. The need for treatment is what determines whether insurance company pays for it, okay? They're not paying for an injury that doesn't need treatment, they're paying for treatment. And the treatment is based on the new injury. So I have to argue these points with judges and lawyers all the time. But the problem is the work comp insurance company always hires doctors to try to lie and say, oh yeah, it's an old disc injury, so it's not covered. And they pay these surgeons a lot of money to say that, even though they know the truth is that it is related to the accident. They'll lie. And they'll go on record and say it predates the accident. And the patient won't get the care they need. And honestly, those are the worst kind of doctors there are. I've known about them for a long time. So why are they the worst? Because they're actually harming the patients, and intentionally, for money. So a doctor that harms patients intentionally for money is the worst kind of doctor. They're not a doctor. They're, what are they, Louise? A charlatan. You're just trying. I love Berndes. He tries to keep me out of trouble. He's like, charlatan. That's what they are. Because he knows what's about to come out of my mouth is a lot worse than charlatan. But he's keeping me out of trouble with my wife, who always says, don't say dirty words while you're operating and you're live streaming. Be professional. I am being professional. But they're charlatans. All right? Thank you, Dr. Berndes. My wife thanks you. They're just really bad people, folks. Doctors are taking an oath to basically put the patient's needs ahead of their own. Okay? First do no harm, and the Hippocratic Oath, which basically means you do what's right for the patient. And when they act as doctors and they give professional opinions that the accident did not cause an injury that needs treatment, they're lying, and they know they're lying. And they're harming the patient, making the patient suffer for money. And that's the worst kind of doctor there is. There's lots of them. Almost every single work comp doctor out there that not treats the work comp patient, but that testifies that they don't need treatment. There are so many of them. There's too many to count. And those guys and gals, mostly guys, it's true, they're horrible people. Here's the problem, though. I'll be honest with you. There's no accountability. There's no punishment for lying. There's no one to catch them. There's no one to punish them. And they get rewarded for lying. So, what kind of a effed up system do we have that rewards doctors for lying? That's where we are. Any questions?
Yes, we have a question from JMC on YouTube
Yep, sure.
asking, what's the difference between ankylosing spondylitis
Oh, no.
and psoriatic spondylitis?
Whew.
Psoriatic
My
spondylitis.
friend. All right, psoriatic. So spondylitis, once again, is a inflammation of the disc, degeneration of the disc. This patient has the same thing right here. As a matter of fact, every human being alive on the face of the earth over the age of 40 has spondylitis. Okay? So ankylosing spondylitis is due to a genetic condition you're born with where your body's inflammatory system causes destruction and fusion of your disc. Autofused, huh? The bamboo spine, Luis, thank you. Luis is correct, the bamboo spine. That's what it looks like on x-ray. Psoriatic arthritis or spondylitis is a type of arthritis associated with psoriasis. If you have psoriasis, then you can say I have psoriatic spondylitis. 5 minutes. Let me grab this out. Thank you, Luis. As far as treatment goes, if you're having pain from the spondylitis, you need this surgery. If you have a fracture, you need a fusion. So, if you don't know what you have, you should be doing the free MRI review we offer at Deuk Spine to get some answers. All right, next question.
No current questions, so we do have a comment from Janet on Facebook
Yes, Jim.
saying it is awful that most doctors don't follow the oath that they took.
Yeah.
It's a greed-filled system.
Unfortunately, it is. It is. But there is a beacon of hope, and that is Deuk Spine Institute, where we put our patients first. First and foremost. Look at all that scar tissue there. So hard. That's what was pinching on his nerve going down his leg. I'm trying to free it up by releasing it, by breaking it up into little pieces. It just doesn't want to break up, but we are. It's slow. It's very slow and painful. All right. Thank you, Luis. Any other questions?
No current questions, but we do have another comment from Janet once more on Facebook
Yes, Janet.
saying, you do, and I'll tell everyone about you and share everything I see from you.
Thank you. Thank you very much. Yeah, I appreciate that. I'm sorry. I was pretty shocked, to be honest with you, when I learned about how some of these doctors just lie for money. They lie. And the lying, is one thing. It's one thing to lie and get money, right? But it's another thing when your lies hurt patients and you make money for lying. And your lies hurt patients and you still do it. And there's a lot of these doctors out there. The system is broken. These doctors should be punished, reprimanded, but there's no way to do that. There's no system in place. There's no board or whatever, no judge that's going to hear it and rule on it. All right, just about done. I need about 2 minutes left. Berndes, 2. That is the tear at 5-1 in the disc. Yeah, he doesn't like this. That's fine. You guys see that little vein? This is the most painful part of the disc, where we have to do the most work. Any other questions?
At this moment, no current questions.
All right. So we're right outside the disc right now. You guys see that?
Yes, we do.
And the last of the tear is right here. I need 10 seconds more, we're done. Little Versed. Huh? You doing a little Versed?
I'm giving a little phone. Sitting on.
We're done.
Thank you.
All right. Any other questions? Feel free to ask. Have we played all the videos?
We have not. We only play the wide back pain.
Let's show people what we just did.
Copy that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, great. So you see that the laser cleans out the tear where all the pain comes from, where the inflammation is. We did all that with an incision that's 2 staples and basically 7 millimeters. Thank you, Luis.
Thank you, sir.
Great job today. Everybody, great job. And thank you, Henry. You can shut it down unless there's another question.
No current questions. Not a problem.
We'll see you all Thursday. We have a big day Thursday. I think we have 5 surgeries. We moved one over to Wednesday.